A new term has been coined for long COVID. The clinical term is known as post-acute sequelae SARS-CoV-2 infection, or PASC for short. It's rather a mouthful, isn't it? Other terms include post-acute COVID-19, post-COVID, and long-haul COVID. People who suffer from long COVID have continued symptoms 3 or more weeks after the first onset of COVID-19 symptoms, regardless of whether they had a test for COVID or not. Some of these people also have new symptoms which are totally unrelated to the original infection. What percentage of people who test positive for COVID or have symptoms of COVID without testing go on to get long COVID? What symptoms do they get and how long does it last for? Some things we don't know about long COVID. We don't know why people get it, why the people who get it and not others. We don't know the total damage in the body that long COVID causes, nor how long an individual's symptoms may last for. But there's a lot of research going on to try and answer these questions. From the UK's Office for National Statistics, 1 in 10 people who responded to a survey who had tested positive for COVID exhibited symptoms lasting 12 weeks or longer. The length of time somebody has to qualify for a diagnosis of post-acute sequelae of SARS-CoV-2 infection is still being debated, but a lot of researchers are using the time 3 weeks following the initial symptoms, or 12 weeks following initial symptoms as qualifying a diagnosis for chronic COVID-19. PASC or long COVID can affect anybody, males, females, children, adults, older adults, people who were hospitalised with COVID-19 or not, or people with underlying health problems or those without. A study in The Lancet showed that of patients who had symptoms ongoing for 2 weeks after the initial symptoms, fatigue, muscle weakness, sleep difficulties, anxiety and depression were the most common symptoms seen. The most serious complications seen are from different systems of the body, as long COVID is thought to be a multi-system disease. In the cardiovascular system, that's the heart, there may be inflammation of the heart muscle. In the respiratory system, the lungs, there may be abnormalities in the function of the lungs. In the renal system or kidney, there may be acute injury. With dermatologic or the skin, people may get rashes or hair loss. Neurological symptoms, that's of the nervous system, include smell and taste problems, memory problems, concentration difficulties, and sleep problems. And psychiatric or mental health problems include depression, anxiety, and other mood changes. The most commonly reported longer-term symptoms include fatigue, shortness of breath, cough, joint pain and chest pain. And other symptoms include difficulty thinking and difficulty with concentration, and this is known as brain fog, depression, muscle pain, headache, intermittent temperature rises, and heart palpitations. Other symptoms seen in people who have had post-COVID symptoms for less than 6 months include chest pain, heart fast rate, depression, chest tightness, dizziness, headache, change in taste or smell, shortness of breath, insomnia, and hallucinations. And symptoms seen for 6 months or longer include difficulties with concentration and memory, fatigue and post-exertional malaise. People also get tinnitus, palpitations, skin rashes, blurred vision, neuralgia, muscle spasms, joint pain, gastroesophageal reflux, constipation, brain fog, tremors. Long COVID symptoms affect people differently, and each individual person will have one or a combination of other different symptoms. The best way to prevent long COVID is to not get COVID-19 in the first place. So we should keep to the government guidelines regarding any lockdown restrictions, continue to wear a mask in public places, stay 2 meters away from people, wash our hands regularly and avoid going to crowded places. Now that we have different vaccines available, I would urge everyone to accept the vaccine. If any of you have concerns about the vaccine, please speak to your doctor about it. I hope this has been interesting for you. The reason why I did this on Talk Mental Health is that there are so many mental health symptoms that long COVID can present with, and I'm sure that those who get other symptoms are likely to then later on, secondary to that, get symptoms of mental health problems such as anxiety, depression, poor sleep, and all the other symptoms that go with that. Thank you for listening. Bye for now.